Hello, my name is Blaise Gimber, and alongside Andrew Hoover, today we'll be presenting our proposal, Chair Clinic in the Classroom, or C-Cubed, where we will be rethinking care from a student's first point of contact. The student we're referring to is the Tommy Boy persona that we created in class. He's an introverted 8-year-old with a passion for video games and Star Wars, and like many children his age, Tommy has a fear of doctors and shots. Today, he's feeling ill at school and would rather not be taken to his ultimate nightmare, a doctor's office. We know there are many children with the same anxieties and fears as Tommy, so we thought, how can we give Tommy the access to care he needs from the first point of contact in a way that is convenient and comfortable to him? Our project, C-Cubed, aims to rethink primary care by placing an emphasis on care from the first point of contact. In our case, the first point of contact is when the child is feeling sick and takes a visit to the school nurse's office. Our proposal gives the school nurse more agency through the use of a child-catered check-in diagnostic chair. Below, we can see the care continuum. Ultimately, through giving school nurses more agency and the help of the chair microenvironment, we aim to skip the steps of patients reaching out, making an appointment, and visit by going immediately from feeling sick to diagnostic and checkout. It is important to note some research behind why care at the first point of contact is so crucial. In the United States, more than 40% of school-age children and adolescents have at least one chronic health condition, such as asthma, diabetes, seizure disorders, or food allergies. When we talk about chronic medical issues, these can only be solved through continuous care, regular checkups, and constant management of treatment. Therefore, having a convenient place for students to go and receive care is vital to their well-being. For these students, school nurses are often the first point of contact and are the only healthcare provider at school. School nurses must play a larger role in identifying health issues as well as daily management of chronic conditions. Through the use of the check-in diagnostic chair, we believe this is more than possible. In this slide, we can see the types of services that school nurses are currently responsible for. We can see that they are already involved in many aspects of a child's day-to-day life. As previously mentioned, they play a crucial role in managing chronic diseases. They may also take care of acute and emergency care if the student has a severe accident on school grounds. They're also in charge of coordination of care, often the first person to notify parents that their student isn't feeling well while at school and may need to be taken to the doctor. Lastly, they're responsible for family management, which might concern the student being abused at home. In this slide, we can see how through the implementation of C-Cubed, we aim to give the school nurse more agency as they're often overlooked as the first point of contact for care. Through the use of the check-in chair, we're giving school nurses the crucial information they need to make a diagnosis, instantly send results to a specialist, and recommend medication. Another issue we researched that C-Cubed aims to solve is known as white coat syndrome, and more specifically, white coat hypertension. This relates back to Tommy's fundamental fear of the doctor. Because Tommy is so afraid of visits to the doctor and receiving treatment, his vitals and other readings can be directly impacted by the stress he's under when he's in an environment that he's afraid of. In one study, 44% of children experience the effects of white coat hypertension. When identifying the necessary digital and physical features of the chair, it's important to first step into the shoes of our clientele and evaluate their wants and needs. For example, little Tommy Boy primarily wants positive distractions in the form of games, an interactive display, and a fun atmosphere. He wants to be distracted from how sick he's feeling, be able to have fun when he gets his vitals taken, and feel like he isn't being treated at a normal doctor's office. In this prototype, we're taking Tommy's love for Star Wars and catering his check-in chair to be an exciting and comfortable experience. As for technology equipped within the chair, it could utilize an early sense cushion to address the white coat hypertension previously mentioned, as it could record the user's blood pressure without them knowing. The interactive display gives Tommy the ability to answer questions on how he's feeling at the moment, as well as show movies and TV when he's awaiting the arrival of the nurse. The closed environment allows Tommy the privacy he needs and makes him feel like he's in his own Star Wars world. Because the chair is also connected to the internet, results from Tommy's check-in session at the chair can be immediately sent to the nurse for review prior to any consultation with Tommy. This is important because the nurse can preemptively suspect the cause of Tommy's issues. If the nurse feels Tommy is in need of further treatment from a specialist, she can easily forward the results of Tommy's diagnostic to whoever is in need of them. In summary, here's the main outcome of our proposal. By providing all children access to care from the first point of contact, we hope to reduce the amount of daunting visits to the doctor's office, as well as increase the accuracy and efficiency of diagnoses through a more appealing and pleasurable waiting experience. Here are our sources, and thank you for listening.